Hello, welcome. I am Dr. Luisa Lucero. I am faculty in the Health Service Administration program, and I'm also the internship coordinator. So the first question, will each of you please tell us about yourself and why you chose to pursue a career in health administration?
I chose Health Services Administration as my path so that if I wanted to interact with patients, I could do that because there are career options doing that, or I could work completely in administration or even something completely unrelated to anything I've ever been interested in before, like industrial hygiene, which is what I'm currently interested in right now.
Hi, I'm Hannah Beeman, and I'm currently a health service administration major at ODU. I'm a senior. I chose health administration because it gave me a broad aspect of healthcare. I started off as a nursing major, and then I changed to health service administration. So it still gives me that healthcare background that I wanted to begin with, but I also get to go into different aspects of administration as far as being a CEO or doing HR within healthcare or public health or anything of that nature.
Hi, I'm Hera Nadeem, and I am a Virginia Beach local. I attended a high school that had a health sciences program. When I first started in college, I thought, oh, I want to be a nurse for many different reasons. But after taking a few prerequisite courses, I realized, do I really want to work with someone one-on-one and see myself in the clinical field? So I spoke to my advisor, and I still wanted to do something in healthcare, but on the non-clinical side. So I decided healthcare administration was the best route for me because it was not non-clinical. I was still able to help people, and it was still like a broad view of something within healthcare if I wanted to do something in law or business or public health. So I'm happy with the course that I have taken.
Hi, so I'm Brandon Young. I'm a master's student. I'm studying public health along with Julia and Hira. I did administration in high school because obviously I wanted to be a CEO as well. I have family members that are COOs and kind of work on the hospital administration side. So that's kind of why I wanted to pursue it. So right now I'm getting my public health because I want to kind of mash the two together. So with public health and then administration on the hospital side, that way I can get a broad view of public health.
Can each of you tell us what it's like to be a student in the Health Service Administration program? And for those of you who have had it, please tell me about your internship experiences.
For me, being a student in the Health Services Administration program, I couldn't have asked for a better college experience. I received one-on-one instruction from all of my professors, and if I had any type of concern whatsoever, I could rest assured that any of my questions or problems would be answered with a clear and concise answer and pathway to guidance without telling me the answer, of course. But my internship was actually with my mom doing agriculture side of human health. My mom works for a company that makes sure that the products that cows produce are safe for consumption for humans. And I was in charge of data splicing. So I made sure all the information was correct so that basically I could see if the milk you're drinking is healthy, because a cow that isn't healthy is producing milk that might not be healthy. So that's just one thing that you can do with a health services administration degree. It's completely different than you would ever think, but something that is very interesting and necessary for human health.
And I can promise you all, her mother did not take it easy on her.
No, she did not.
Hannah, what about you?
So as a healthcare administration student, it's definitely kept me on my toes as far as networking. It's allowed me to have different opportunities such as this, talking to other students in the program and meeting people outside of school in different healthcare facilities and community centers. The online program, once you get into your major, is definitely amazing. The professors work with you all throughout the week. If you need them on the weekends, you can definitely call them or text them as necessary. This program is definitely filled with great information and great professors and faculty members.
Kara?
So I am happy I did choose ODU with a health sciences degree because the professors were nice, approachable, had an open door policy, and I felt safe talking to them. Because trust me, I've had friends who went to other universities and they just felt like another number or another face. They didn't feel comfortable talking to their advisors or their professors. So I'm really happy and blessed with the professors that I had. They really want to help you in every single way, which of course, without giving you the answer, but they'll help you navigate through the courses and understand your coursework. And as for my internship, I worked with Dr. Kiki and Dr. Wen in the Global Health Center, which is within ODU. This internship provided me just an insight of public health and how to help the underserved community.
Brandon?
Cool. So what it's like being a health administration student, I can kind of piggyback off what everyone said, but I love the faculty. I'm a person, I ask questions when I don't know something. So I actually had an awesome advisor, Miss Leanne White, who guided me and kind of just paved the way for me. And then I had a situation happen as far as Miss Lucero, who helped me in my last course. It's a whole different situation I could talk about, but I really love that experience. And then just more about my internship, I ended up doing Virginia Department of Health, and I work with the Office of Health Equity in Richmond. So that was actually good because we kind of worked on like the rural health side, and it kind of led me to see the public health side. That's why I ended up pursuing a master's in public health instead of hospital administration, because my dream goal is to still be a CEO, but it did kind of open my eyes up to a lot more opportunities that are out there.
Hera, did you want to tell us about some of the projects you work on at Center for Global Health?
Yes, so one of them was working, I forget the name of the project, but we're working with children, I believe elementary or middle school age, and we're talking to them about nutrition, recycling, and the environment, and also sugar, and like how that can really affect you and how much sugar is in, like, let's say a bowl of cereal or in that snack you're eating. So it was interesting to not only research that, but also teach it to such young kids who are very impressionable. So I felt really good just sharing that information with them.
Great. So for our alumni, we have 3 on this Zoom call, all of which are in graduate school. So can you please tell us about your experiences with graduate school? All 3 just successfully are in the end of their first year. So they're doing very well for themselves.
Graduate school for me was a very scary idea, but ODU has really paved the way for me. I'm in the first year of the program at Old Dominion, and I couldn't be prouder to say that. It was such an easy transition from ODU's undergrad to my master's degree, because I get to work with the same professors that you guys will get to work with during your undergrad, and they are so supportive, and I can't say that enough. Dr. Lucero, I still go into her room and talk anytime I'm worried about something or need help with maybe not questions to homework, but any question with my future career, or if I'm just stressed out, I know that I have professors and faculty who are there to support me. And that's the number one thing that I can rave about my time in this master's program.
Well, to already have 3 alumni, who are in the ODU MPH program, that should really speak volumes. So like Julia was saying, you are working with the same professors, and the transition was very easy. I have enjoyed the coursework so far, and obviously in this COVID pandemic, you can see how relevant everything is. And I am actually, of course, in the Master's of Public Health program with a concentration in global environmental health with a certificate in global health. So they give you so many options to just really fast track your career and really see yourself as a public health professional.
Brandon?
All right, so definitely could say what both of them have said to you guys, but I can say graduate school is definitely, it's challenging, but it's not difficult. It's definitely possible. You can lean on to others. The thing I do like about it is that people around you, they help you, not even only the faculty, your cohort. I know I can text them, or I can depend on them, or I can call them and they're just one call away if I have questions, or obviously not helping with homework, but just kind of guiding you and just lending a hand. That way you can get another opinion about an assignment. But definitely ODU, I'm definitely proud to say that I did it, to say that I got through 1 year, and just looking forward to the second year done.
And they will all do very well in their second year, I'm sure. So final question for our panel. What advice do you have for incoming health service administration students?
Make sure that your time management skills are on point, because online might not be easy for some people. It's actually very difficult in the grand scheme of things. But if you can allocate your time effectively and make sure that you are completing assignments by the due date or before the due date, you will be so successful in this program, because this program is really all that you make it. And that's the number one thing that I can continue to say is the effort that you put in is the effort you will see in your GPA. So just focus on the controllables, and that is making sure that you get your work done, that you're doing the extra reading, or making sure that everything is done correctly and adequately, and making sure that you are putting in your greatest effort.
Okay, Hannah?
Network. Get your foot in the door with your faculty and staff members. Go to office hours as soon as possible, even if you don't have a problem in the course itself. Just ask questions, get to know your professors, because they will be the ones to write you those reference letters once you're done with your program for grad school or any occupation that you applied for. I'd also say just continue to stay organized, get a planner, write down your to-do list for the day or the week with these courses, and just keep focused and stay grounded to your purpose and what you're going to do after undergrad.
Kara?
I would say as a freshman, be prepared to read and write a lot more, because being an online student and having so many case studies, you learn very quick to not only talk to your professors, but go to the library, get those resources, get help anywhere you can. Because after graduating with my bachelor's, I did feel more confident for graduate school. I felt more prepared, because now we read and write a lot more, present and work in more advanced group settings with more real world topics. And definitely network with the professors and attend any event that you can that is interesting, because it only helps you at the end.
Brandon?
All right, I would say the biggest thing is get experience. Just kind of try to get yourself out there, just like Hannah said. Network is a key. Connecting with others on campus, using the services that ODU provide to match well with the health administration side. This has been my friend for life. This student planner right here, telling you, it's got me through a lot of things as far as remembering assignments. And then another thing is, I would say, if you kind of know your path and what you want to do, try to get that experience as far as like volunteering. So I would say my junior year, I volunteered in a hospital. That way I can kind of see the inside of the hospital and get insight and see like, okay, so this is how it is in a hospital setting. So definitely volunteer and get that experience early and jump on it, because definitely time will fly.
Okay, so if we can go back to talking about what courses and stuff that you took in the program, we can go through the line again. I'll start with Julia.
Some of my favorite courses were managerial epidemiology, which is understanding how certain health disparities or diseases or infectious diseases may impact the greater population, and understanding how the greater population may be impacted by that. What I've taken from that is I have a job opportunity being a contact tracer, which is essentially finding out where coronavirus originated and going through the lineup. So if your dad has coronavirus, I will basically try to understand every single person he's come into contact with or stores that he's gone to try and see who gave the virus to him. And I will then go to that next person and do the same thing all over again so that we can try and originate the virus. So a lot of my courses coincide with that future job. Understanding global health is going to be very important for my prospective job. Also, just general public health courses that I received during my undergraduate.
Hannah?
So one of the courses in the program is health ethics and the law. So basically that's applying the law within the country or outside countries if that's the population you're working with, and connecting it with those healthcare related issues. For instance, COVID-19, there could be a case later down in 10 years from now that you want to address and pull up, and then the law that you apply it to will help you understand what happened with the case, or how did the virus outbreak spread to other people, or what happened when different people contacted that the virus, and then they can then go back and establish a reasoning behind it and determine what can happen going forward in another outbreak. So that class is really interesting. It does allow you to critically think a lot, but it was definitely a good course.
So for me, one class that I remember standing out was financial literacy. It was all about finances. So it really broke down of, if you are a healthcare administrator, where is the money coming from? Where is it going? Are you overpaying, underpaying? And then one other class was an introduction to public health. And that one I actually enjoyed more because it was one assignment was doing something online to where you were just part of a team of like epidemiologists or public health professionals, and it just showed you if an outbreak occurs, the scientist is in the lab, the field person actually goes out in the field and tests the water, the garbage can, the ground, the air quality, just to see where the virus first occurred. And all these people, come together and work together just to see where's this virus coming from and how they can resolve the issue, just so less of the population becomes sick.
Brandon?
All right, a class that I remember off the top of my head was financial budgeting in healthcare, I would say. In that one, being that I want to be a CEO of a hospital, and you kind of talk about the administrative side, it's a lot that goes on the financial side as well. So I remember talking about things like the balance sheets, assets, liabilities. All these things are like things you need to know. And then working in the internship with health equity, I kind of got a little hands-on experience with that, where I did work on some grants sometimes with a couple of the people in the office. So yeah, it just kind of gives you a variety of the financial side. That way you will know how to budget, and then you will know about these things when it's time to get in the real world, or I would say the healthcare field.
Brandon, do you have anything to add about your internship in terms of what you just said?
Oh yes, so I do. Actually, so with the internship, I worked with someone else. Actually, I connected. I got to do something very cool. So they have this thing in November. It's called National Rural Health Day, I believe. So I actually worked on a comic book along with someone else that was an intern there, and it kind of brought everything together as far as like networking. I had to network with someone from another office within VDH. Then we had to connect. I had to connect to, I want to say it was some building or some company that actually created the comic book. So I had to first connect with someone that knows how to do the comics as far as like draw and everything. And then I had to actually get with the company to create the comic book for National Rural Health Day. And I think it is going to get shown this year in November, I believe. But then it was another thing I got to do as far as set up a meeting where we had, I cannot remember who, but it was some people coming from out of town that was having a meeting downstairs, and I got to plan that, and it showed me like the finance side of that and how to like plan everything as far as like program planning. So it was a lot of different opportunities. I could talk about like probably 5 or 6 things, but that's kind of like 2 opportunities that I remember that were enjoyable to me.
And then you currently have a unique situation with your current internship. Can you tell us about that in the context of COVID-19?
Yes, ma'am. So currently, I did get just blessed with the opportunity to do like an internship with housing. So I am a hall director already. It's my grad assistantship. So along with that, I'm the only student within my cohort that is studying public health. So they thought it'd be pretty cool to get me to be an intern, being with the recent situation with COVID-19. I'm going to be a risk management director. So that way we're kind of thinking about things as far as like being that people have to stay 6 feet away from each other. So we've been kind of having meetings about, are we going to have roommates next year? How is it going to look when everyone comes down with the laundry machine? As far as using laundry, it's going to have to be different times. So we've just been kind of discussing things like that as far as what are things going to look like next semester, just in case COVID is still here. So just talking about all the different risks and then the emergency management things that just are popping up. So that's a good internship, and I just hope everything goes well with it. And that's just showing you that there are many opportunities out there as far as in the public health field, and just expanding my knowledge in health administration as well.
One thing I'd like to add, just so you guys are aware of the opportunities available to you, each of our alumni all received a graduate assistantship when they went into the Masters of Public Health. So that's pretty impressive for each of them to get one and be with us here today. These students definitely represent the best and brightest that we've seen over the last couple years in the Health Service Administration program. But I am confident that any one of you can come into the program and be just as successful as they have been. We are so excited to meet you. Don't be a stranger. You don't have to wait until you're actually accepted into the program to come meet us and say hello. But we're excited to help you get through the end of your career and become successful health service administrators.